Everybody see all this? Good, I'm on. Is it dark up here? Is there a light I can put on? Can you guys see this? Okay, good. How do I go about coming up with these topics? I go based on patient population that I take care of, and ultimately what I saw that I couldn't believe was children. Children have fatty liver disease. Children. I mean, this is driving me crazy. We're not doing anything about it. No one's even talking about it.
It's all the preservatives in this food.
Part of it. But the bottom line is, guys, that what's happening is when I go across or find out something and look it up, when it gets my attention, I like it to bring it to your attention. So the big thing today, this is what it used to be called. Non-alcoholic steatoretic. Steatoretic stands for fat. Hepatitis, okay? And up until 2000 and I think it was 18, 17 or no, 16. 2016, liver disease from alcohol was way over as the #1 cause of liver disease. It's now second. What's first? Fatty liver disease. And it's taking children's lives. That's what just, I can't imagine that we tolerate this and accept it. And so when I found out what I read and saw the data that's out there, and then I saw that they're actually changing it to these terminologies, what you realize is they're categorizing it in such a way to not make it look so bad. Does everybody follow me? Like if you just had NASH, non-alcoholic steatoretic hepatitis, listen to this number, guys. This blows me away. 80% of Americans have it. 1 out of 3 of us in this room have it. We don't know it because there's no symptoms. Does everybody follow me? Okay? So the data that's out there that proves all this, no one's talking about. And that's another topic we're going to get to, I think, in 2 months. The other thing no one's talking about is suicide rates in children today. But that's a whole other subject. So back to what we're doing. I had a patient come into my office. He's currently 33. When he came in, he was 28 years old. And he was fatigued. He's an accountant. He was depressed. He had recently been married. So we put him through a battery of tests. And ultimately what happened was I finally got into his diet. And he was eating all junk food, going to McDonald's or Burger King or someplace every day for lunch. And so I checked the scan of his abdomen. He had a fatty liver. Here's the good news. I made him quit drinking alcohol, quit going to fast food restaurants, quit eating fructose corn syrup, and he had to exercise every day, and I gave him an exercise bike. I have 6 children. After each of my children, my wife would buy some kind of exercise equipment to lose weight, but she never did it. So I gave him the bike. It was one of those ones that when you pedal, your arms move. And I told him if he did all this stuff, all the fat would go away. And he didn't believe me, but he did it, and all the fat went away. So it's reversible. That's the part that makes me so crazy. We have children in America dying. We know what it's coming from, and no one's talking about it. And it is reversible. Does everybody understand that? Why? The irreversibility, and I'll go through it all with you, is before we hit inflammation. Everybody understands inflammation, but we'll talk about it in a minute. The best way to describe it is if you scratch your hand, it's going to get red, and then it's going to get warm, and if you break open the skin, it's going to bleed. And what stops the bleeding is this inflammatory process. And then we form a scab. Okay, so everybody understands that? That happens inside our body as well. So once the organ gets inflamed, that's where the trouble comes from. And we're going to talk about that, what happens with the non-alcoholic hepatic, the fat around the liver. Once it gets to the point that there's so much fat and inflammation occurs, it leads to fibrosis, and that's what's killing children. Listen to what I said. Killing children are dying from this. And 1 in 3 people in this room have it right now, don't know they have it. That's just blows me away. All right, we're gonna come back to this slide in a minute, but basically what this is these are metabolic fatty liver disease, non-alcoholic fatty liver disease. You see how they had to get this FL part in. And then this one was a mechanism of metabolic, what's the word I want? I forget what the A stands for, guys, but it's all metabolic, and we'll run through and it'll hit me while I'm doing it. What you have to understand is the process. And the best way for me to show it is to draw it so you understand it. Okay? The esophagus. We're not worried about the heart and the blood vessel. The esophagus comes down, goes into the stomach. Behind the stomach is the pancreas. On this side is the liver, and from the liver there's a duct, and from the pancreas there's a duct, and this part is called the duodenum. When I can't spell, I scribble, okay? And then from the duodenum, we have about 150 feet from here to the statue of small intestine. And then it comes over on the right side at the appendix, begins the colon, that's the appendix. Ascending, transverse, descending, sigmoid, out to the rectum, okay? So this is the nutrition that you want to understand, because there's a system called portal vein. Once everything gets absorbed from the small intestine, everything. Everybody understands that? Everything goes to the liver. So whatever you put past your lips and chew and eat and swallow, eventually the pancreas secretes enzymes, the gallbladder works to secrete the bile, to break everything down, and it goes from the duodenum, the celu, into the jejunum and ileum. And basically what happens is that's where everything gets absorbed. And everything goes to the liver. Everybody understand that? Everything. So whatever you put past your lips, it's going to the liver. Okay. What's the liver do? Answer, everything. What does that mean? It takes carbon, hydrogen, what am I thinking about? Nitrogen and oxygen. These are the organic substances. So anything that comes into the liver from the portal vein breaks it down into this, and then it forms nucleic acids, amino acids, and other proteins to transport everything that needs to be transported in the body. And that's how it works. And it's constantly working. And the blood supply from your heart is probably about 20% goes to the liver. And the only way you bypass the liver is under the tongue and rectum. That's how you bypass the liver. Otherwise, anything past your lips is going to the liver. So everybody understands that concept. All right. Now, what occurs at the level of the liver? Draw a big liver. Okay? There's a right and left to it is what you want to know. Inside, the cellular activity metabolizes everything that came in. So it rids the bad stuff, keeps the good stuff. And these are called sinusoids. And what's that mean? These are sinuses within the liver, blood vessels, and they go to the hepatocytes because it's a very bloody organ. So it's full of blood, and that's the process that occurs that filters out everything that you just ate. Now, whenever we want to keep it, if the liver decides we keep it, then obviously it circulates. If the liver decides that we want to get rid of it, then the liver has a way of detoxing everything through enzymes. I'm going to put it, I better spell it so we know. And so we hear of liver enzymes, ALT, APT. Alanine, these are all pathways that what happens when the blood gets to the hepatocyte. That hepatocyte stands for the liver cell. Whatever it has to do, does it detoxify it? Does it add water to it? You know, that's called hydrolysis. Like, what is the process? Whatever the process is, the liver does that. And it works constantly, okay? But while it's working, it knows how to detox and do everything so the enzymes are normal. So if you get a blood test, your liver enzymes should always be normal. So what happens now is, once this process is functioning normally, all labs are normal. What happens if the labs, these enzymes, elevate? Infection, inflammation, CHF, too much fluid in there. These are common ones. And then we'll put here cancer, and now we have to add fat. And up here, alcohol. And we can put other drugs. You can take a drug that your doctor prescribed at a higher dose than is supposed to be prescribed, and you'll get trouble with your liver. Tylenol, you can't take more than 4,000 milligrams of Tylenol a day. So if you take the 500s and you do 2 of them at one time, you can't take more than 4. Why? What happens? The liver has to metabolize it. And if you make it metabolize that over a period of time, it can get inflamed and it can cause trouble. Okay, everybody follow the concept of how this all works. You have to recognize that there's a mechanism that everything goes to the liver. Once it gets in the liver, normal metabolism, the enzymes complete their task and stay at a normal range. So what we look at when we draw blood on a patient, if that elevation has occurred, there's a reason for it. Everybody understands the concept? All right, so now symptoms. Symptoms of fatty liver disease. Symptoms. What does that mean? None. You can have fat around your liver up to 30% and you don't even know it. Okay, so everybody understand that. So the liver is an amazing organ. It can get bigger without any problem telling you that because it's bigger, because there's fat around it, that you have pain. But that's a good and a bad thing. Good thing you don't have a bunch of pain, but a bad thing you don't know that it's fat around the liver. So everybody understand the concept? All right, so symptom-wise, none. Changes seen usually after fat hits a percentage up to, they say 10 to 20%. Once you reach that, most common is fatigue. Second most common is insomnia. And third most common, memory changes. I'm just putting this over here. Common symptoms is someone depressed. So everybody follow me. So what's happening is that a disease process that one of every 3 of us in here have, that no one's talking about, is doing damage to children, actually taking their lives, and we don't pay attention to what we eat. You know, that's just who we are and how we are. We trust the people that put the commercials on TV, and this is good and that's good. You guys are lucky because you have it all taken care of, but the point is that what we put past our lips goes to the liver. And so you have to pay attention to what is causing this problem. Does everybody understand the concept? All right, we're going to go back to this one in the first slide. But just to develop breakfast, lunch, dinner, snack. The cadets at West Point are the study group, and they've been studying for at least 100 years. And the Framingham study in Boston also is a big group where they've been studying for years. And with the information they find with this is that the diets this data blew me away. 2.5% of children born in this era in 1992, they did retrospective studies. And then in 2023, they did global studies. And they found that 2.5% of the children that were born in this era in 1992, 85% had fatty liver disease, and only 20% knew. Everybody sees that data, you know. And again, guys, we didn't have fast food energy drinks. We didn't have DoorDash that could drop you in. I mean, I live on a farm. I have a long driveway, and the kids were all just home. And I'm seeing cars coming down. My dogs are going nuts. It's like, who's here? Oh, DoorDash, Dad. You know, like 3 or 4 times in the night, they would have snacks dropped off. You know, and the stuff they're drinking is unbelievable, full of sugar, full of caffeine. That's what's causing all this. And it's amazing because no one's talking about it. Okay, so again, what I want to make sure everybody understands is that in between meals, no food. Drink water, decaf coffee, or tea. Tea. No sugar. Okay? Whatever your breakfast happens to be, make sure you pay attention to portion size. Snack. You can have it before you go to bed, but you give yourself 1 hour before you lay down. Why? Because if you don't digest the food and you lay down, you're going to get reflux. What is reflux? Inflammation. What is inflammation? A killer. It's causing troubles because of our nutrition. You don't want any inflammation. So what's the most important thing? Posture. The way everybody's sitting right now in the chair, because it's hard back, feet on the floor, back up against the back of the chair, that's the posture you stay in. Chew your food 30 times, and you make sure you stay in that posture 10 minutes after you eat. In the good old days, we used to sit around and talk. You know, now my kids like grab the food and run out the door. Like everybody's busy. It's all this fast pace, and we have to pay attention. Posture is the most important. You have to stay straight up and down to allow the food to make its way down to the esophagus. If you chew the food 30 times, you begin the digestive process even before it hits the stomach. And you stay that 10 minutes in that upright position so as to not cause reflux, because that inflammation causes problems. Okay, so everybody recognizes that the data from Framingham and Boston and the cadets show that if we keep this diet, this schedule of food, not diet, schedule of food, breakfast, lunch, dinner, and a snack. What do you have? Portions. That's the most important thing. Not to say that you can't eat the wrong foods all the time, even in normal portions that potentially cause trouble. You know, you have to watch the red meats, you have to watch the fat around the meats, you have to watch the carbohydrates, and you do not want any ultra-processed food. What's ultra-processed food? That means that they take the food and they freeze dry it, and then what they do in that whole processing plant, if you will, is they get rid of the ones that aren't going to sell, throw those away. I hear they make dog food out of them, and then the ones that they can sell, then they process them again so they stay. What are they putting in it? salt, fructose corn syrup. I still remember the first day I went to get bread at my mother's house. I think I was in college. And I opened up the bread thing, and as I took the bread out, it was green on the corner. And I go, the heck is this? She goes, penicillin. And she ripped the end off. She goes, eat it. And here, that's fructose corn syrup. It turns green. And again, what happens is, sorry guy, this must be my bookie. They're after me. What happens is that all this is to keep the product on the shelf. The salt, the fructose corn syrup just keeps the product on the shelf. And this is an amazing story. My wife grew up in Scarsdale, New York. And so all the names of her friends growing up were like Mattel, Levi, that kind of stuff. Guess who paid for the invention of fructose corn syrup? The Post brothers. And they did it in Egypt. The studies were done in Egypt in the 50s. And they didn't get it approved in America until 1983. And we're the only country that allows 100% fructose corn syrup. All European countries, Australia, the Asians, don't allow more than 5% fructose corn syrup in their products. So please pay attention, guys. It's a preservative, and it gets in everything. So know where the food's coming from. Every food in America has to have the ingredients. And the first ingredient is the one that's largest amount in the product. And you'd be surprised how many times you read fructose corn syrup first. I don't know if you guys, I think the Super Bowl they said was in 2017, where they actually had commercials. The advertising of beer companies were kind of fighting each other because there's only like 2 beer companies that don't have fructose corn syrup. All the other beer has fructose corn syrup in it. Not for flavor, not to sweeten the beer, just to keep it on the shelf longer. Okay, so please read the label and pay attention, guys. All right, so back to this. What I'm giving you is, this is how we're supposed to take care of our body. Have a breakfast. Why? It means breaking the fast. Even if you have a glass of juice or a piece of toast or an energy bar that doesn't have fructose corn syrup and all the bad stuff in it, you want to put something to break the fast. Lunchtime, they talk about the lunch should not cause bloating of your abdomen, okay? Because what happens is, and it's individualized. I mean, I know people that can eat a half a pound of pasta and don't get bloated at lunchtime. But if you get bloated, what that shows is the digestive process is slowed down. And so if that's occurring, make your lunch lighter because it's better for you overall. Your dinner, same thing. Make sure you take that 10 minutes though and sit because it's in portion. What's the portion size? Okay? They talk about being the size of the palm of your hand. But of course, some of us have bigger palms than others. The bottom line is you don't want a whole steak, even though I love to eat a whole steak. That's not healthy for your body. So they talk about the portion size, the palm of your hand, of whatever meat that you're gonna have. And then again, you can eat whatever you want. Just make sure the portion is a normal, small portion. And when I say small, it's relative to, last time my youngest son came home, my wife had just went and bought chipped ham because the kids were coming home. And I saw him grab a handful and put it on a bun, and it was this big. And he thought that was normal, And he's like, Dad, I just have to make 3 sandwiches. Like, it's all going to the same place. And it's like, you shouldn't eat that amount of any foods at all because, again, it was ham, so salt on it for sure, fat, etc. But you can't tell them. Like, that's the part, I don't know about everybody here, what they've seen with children, grandchildren, nieces, nephews, but the world has changed so the kids have more control. I remember the first time I said, where's your grades? I got them, let me see them. You don't have to see them. What do you mean? I'm paying a bill. You don't have to see them. And so then my wife called the college, they were at Duquesne. They give the grades to the children. I paid the tuition, but all this stuff goes to them. And there's some rule that they come up with now. So all those things, they feel they know better than we do. And no one's talking about this. So pay attention, guys. All right, so this we'll come back to also, because I want to make sure at the end I summarize all this. All right, now, we're going to put metabolic associated fatty liver disease. Why? Anybody ever heard of metabolic syndrome? Obesity, elevated lipids, specifically LDL, hypertension, diabetes, what am I missing? Oh, sedentary. I scribbled because I can't spell it. Okay? Metabolic syndrome, the first time I heard it was pretty amazing. There was a surgeon down at Allegheny General Hospital. I started off doing surgery. I worked with Starsville doing liver transplants at Pitt. And then one day I was scrubbing to do a gallbladder, and I see them putting air in the lady's belly. And, you know, scrubbing at the sink, and I'm talking to the other side, like, what the hell's going on? Oh, it's a new technology. It's like, what? It's called a laparoscope. And I'm thinking, what that? So you go, there's a teaching scope. I don't have my stethoscope, but it's about the size of a stethoscope. And you look in, and it's fiber optics. You could definitely see the gallbladder, but not the way surgically we like to see the gallbladder. You know, we used to use ways that you open up the surgical area to see everything, plus you felt it. And that's how I got out of surgery, because I really couldn't see the gallbladder. And then they say, you put a probe through the belly button and you lift the liver up so you can see it better, but you don't see it. But my whole point to it is that the process of fat around the liver, unless you actually touch the texture or get a real good scan ultrasound, you sometimes even miss that as well. So what you want to make sure of is that when you're seeing a patient with metabolic syndrome, even if they're asymptomatic, that's what that stands for, no symptoms. If they're obese, if their lipids, specifically the LDL is elevated, they have or they're treated for diabetes, or excuse me, hypertension, they have diabetes, and they sit per themselves more than they used to. What you want to do is make sure sonograms are very inexpensive and they tell the story. You want to get a sonogram of the right upper quadrant to get a look at the liver itself to see if there's fat, because it'll pick it up even if there's a small amount. Okay, so again, guys, this metabolic syndrome has been around. When I met this doctor, I was sitting in my office, and he walked in with the guy. He wanted me to go to Israel with him. In Israel, there's no diabetes, and there's no fat around the liver. And I was like, what? There's no fat, and there's no diabetes. And so what happened was, with all the people coming from America to Israel at that time, this was back in like the early 2000s. The doctor's name was Dr. Janetta. He ran the neurosurgery down at AGH. And so we were going to go over because he felt, he's a neurosurgeon, he felt what happens is that you get swelling at the base of the skull. It's called the magnum foramen. It's where the spinal cord makes its way down from the skull down. And he felt that swelling there was what was causing diabetes. And so he found that in Israel, the people that were there without any diabetes because of what they ate or what they didn't eat, and then the people coming from America and other Western countries to come live there, they found diabetes took off. And it was remarkable because the swelling comes from salt. Does everybody understand? So what you want to make sure of is if they have all this, you made the diagnosis, but you want to find out the salt intake, sugar intake, and fructose corn syrup. And on top of that is the genetically modified foods. They call them GMOs. They're the super processed. Those four things can create a change in your body. And again, this is just anecdotal stories. I didn't go, but the people that I know that did go, once they reduced that swelling, they got rid of a lot of diabetes. And it's pretty remarkable how studies that are done globally don't make it to our televisions, but every drug out there to treat everything and every vaccine known demand is on TV all the time. So please pay attention. All right, so now what I think is the best is I want to go back to the ones, man, they're after me, guys. I'm sorry about that. All right, this is the one to understand most, all right? Whatever you're eating, continue. Portions are important. This is all based on what your PCP tells you, okay? So what I'm gonna tell you is individualized based on what your doctor says. But you need to get 8 to 10 glasses of water a day. Once again, if you have congestive heart failure, bad liver disease, bad kidney disease, so I don't want you doing anything unless you talk to your doctor, but as long as your doctor says it's okay. 8 to 10 glasses of water. Why? Imagine I have a glass in my hand full of water, and now I put salt in it, okay? And we measure what's in there. Like by checking that solution, we can say how much salt's in there and how much soluble water's in there. Now take the water. What concentration is going to go up? The salt concentration. Does everybody follow me? And what happens is salt gets out of the body with water. So we dehydrate our cells. When we dehydrate our cells, we set up inflammation. Does everybody understand that? You have to understand that, guy. Now again, check with your doctor, because if you can't take it in based on some disease process, okay, but otherwise, you want that for the liver to function well, for your food to get down into the stomach. The hydrochloric acid requires water. And if you don't have enough water and you get dehydrated, that's how you end up with gastritis. The pressure goes up right here. It's called an LES, lower esophageal sphincter. They claim that the average age is 25 when we lose the competency of our sphincters. They say none of us have competent sphincters anymore. And that's because the foods we eat cause so much pressure in the abdomen that pushes back against that LES. Okay, so pay attention that watch the portions. Water helps the most to help digest the food. And then everything that occurs in the small intestine is absorption. And the absorption is best done with a hydrated environment. So it's good for the absorption. Then when the stool or the food makes its way to the colon and the stool is formed, what's the only thing the colon does? 2 things. 1, contracts. It's called peristalsis. Contracts. What's the other thing? 2 things. That's all it does. And what's the other thing? Absorbs water. That's all it does, guys. So if you're not taking in those 6 to 10 glasses of water a day, what can happen is the metabolic pathway in your system becomes inflamed. And when it becomes inflamed, it's taking energy away from you. That can lead to the fatigue. That can lead to just, you can't sleep at night. There's a lot on your mind. All these things are interrelated, but it's all dietary. And remember, we'll go over this again before we're done. There's 2 systems, parasympathetic and sympathetic. And the eponyms for these, parasympathetic is rest and digest. Sympathetic is fight or flight. Sympathetic first. The stories of a mother gets in a car accident, baby's trapped under the car, and the mother picks the car up. True stories. Why? It's called adrenaline. What's adrenaline? The little gland about the size of your thumb that sits on top of your kidney produces it. It's the chemical in your body that gives you that ability to fight or to run. Either way, it supercharges you, okay? The parasympathetic is rest and digest. They go hand in hand. If you're not sleeping, what's wrong with the GI tract? There's a connection. There's definitely a connection. And what I find most times, water. We're all dry. So please pay attention to that. All right, a lot of stuff on here, so I want to get to a different one. But again, remember what I was talking about in terms of what does the colon do? Contracts and absorbs water. And if you're not taking in 8 to 10 glasses of water, it's absorbing all the way through your GI tract. Well, that's a muscular process. You can get cramps from that. You can get like doubling over cramps from that. I mean, this is something, you don't want your colon to have to absorb any water. You want to drink enough so all it does is contract. That's how you want to make sure you understand this. It's very important, okay? Now, what I want to make sure everybody gets, remember what we talked about with the symptoms and the depression, which is so close to it? I want to make sure everybody understands that because these symptoms are so similar, you have to understand the impact of inflammation. It's so important, guys. And what happens is our general nutrition, we have inflammatory processes that can't occur unless you're paying attention. Remember what I said about the posture? That's the number one. If we eat and go sit in a couch or sit in an easy chair, you're leaning back. And none of us have lower esophageal sphincters anymore. So what's in the stomach? Acid. So you have acid going up through the esophagus. You may not even feel it because only the top third you control. The other is called smooth muscle and you don't feel it. So you can have reflux just from posture. And that reflux inflammation builds up pressure. That pressure can cause GI troubles. Those are the things you want to pay attention to. So please, I didn't even put water on the screen. I'm just showing you back to the, what are you going to see? Fatigue, insomnia, memory changes. This was the good one. Diet. Made this change. So from the 40s to 70s, what we ate, we all know it was routine. Everybody's family pretty much cooked the same. It was just same foods, different ethnic groups. I remember the first time I ate what I call a pierogi. I was like, wow, this is ravioli. And the mother was like, what? I said, this tastes like my mother's ravioli. There's no sauce on that. I said, I eat them plain. This is ravioli. She goes, no, that's a pierogi. I was like, okay, looks like a ravioli to me. But the point is, all the foods are very similar, and we ate well. You had to have a breakfast. I couldn't leave the house without having some kind of breakfast, whether it was a piece of toast, a bowl of cereal, mother's oats, if that's whatever it was. And at lunchtime, we got a lunch packed. So you had a sandwich, an apple, maybe something to drink. And what you end up with is those are good habits, but they all changed. I lecture at a couple different schools, and I was so shocked. It was at, I don't want to name the place, but it was in the North Hills, and it was like some kind of, they had something in the auditorium that they had to go, so they were going to be late, and I knew that. So I decided to go get a drink. So I walked down the hall, past the cafeteria, Pepsi machine, Coke machine, candy machine, water fountain. So I go to the water fountain. It didn't work. The water fountain didn't work. And all that was in there was fructose corn syrup. Children, the cereals, the candies, the sodas, it's all fructose corn syrup. And this was the statistic, guys. 85. One out of every 3 of us have it, and we don't know we have it. That's a lot to not be talking about. And that's a lot to, and again, they don't want to hear it, because my children are in their 30s now. And I'll bring it up. We just had a picnic. Someone went to the store and got a whole bunch of cookies. And I read the box. Fructose corn syrup. They're down like it's nothing. And again, no symptoms. No symptoms, I told you. So what do? You know, you can't force them, but you push them. You know, and that's why I feel, again, knowledge is the tool. And pass it along, guys. And make sure, again, remember what I put, an hour before you go to bed. Just like whenever I talked about making sure you sit up for 10 minutes after you have your supper. Because they say supper's the biggest meal. You know, breakfast is the most important because you're breaking the fast. But make sure you sit for 10 minutes. And I'll tell you right now, 10 minutes is a lifetime. You know, like I can remember making my kids sit there with me. Dad, I got homework to do. Yeah, right, try another excuse. You know, but the bottom line is it's still 10 minutes sitting up after the meal. All right, guys, this metabolic syndrome, from my vantage point, the most important. Obesity in America is more common than apple pie and Chevrolet. And I'm obese. I'm guilty. You know, it's become, it's not a habit, it's become tolerated, I guess is the best word. And so what occurs is we are all having factors related to your health because of the metabolic syndrome. And again, obesity, if you have high lipids on top of that, if you're taking medicine for hypertension, if you do indeed have diabetes, and if your lifestyle is sedentary, then you're setting yourself up for troubles. And the troubles that come, we never anticipate and we never expect. And those are the difficult things that occur. And sometimes I tell patients, like I had a patient recently that fell and broke his hip and had to have hip surgery. And we canceled it beforehand because he had low pulse rate. We call it sick sinus syndrome. So he had to get a pacemaker before we did the hip. But it was just dumb luck that it all happened that way. You know, we don't pay attention to what we're eating, so we don't think of anything other than how we feel. And if we feel decent, we just push along. You know, but the reality is what you want to do is pay attention to what you have to for your health. Okay? These are the big ones, guys. Salt, sugar, GMOs, fructose corn syrup. July 4th, 2026. I bet my children $500. I have 6 children, and a couple of them are married. So there was probably about at least 10 people that went out on this one. I said, I'll give $500 to anybody who brings me hot dog buns without fructose corn syrup. How many got $500? Could not find hot dog buns on 4th of July, was the day before, without fructose corn syrup. It's in everything, guys. It's literally in everything. And like I told you, it's in products not for the sweetness, but just to keep them on the shelf. So what does that mean? Because of the sweetness, they have to put another chemical in order to hide the sweetness. So what's in what we're eating is absurd. And again, we all thought that someone was looking out for us. It's all dollars and cents, guys. It's absolutely amazing. But you have to pay attention. I have a lot of seniors down in Bellevue that are patients. And I still remember, I think it was called Healthy Choice. One of the dinners that you can just throw in a microwave. And like they thought, it's healthy, right? Because it says so. 700 milligrams salt. And it was only a little box. You know, those are problematic. My father had open heart surgery. Pre-surgery, he was on 1 blood pressure medicine. Post-surgical follow-up, he was on 3 different medicines. And I had the key to the house. And it was always the same. You know, Dad had money, but he thought he was going to, you know, be broke because he said he lived during the Depression. So I open up the front door, dark everywhere. I get into the family room, and he has one of those pools that have those lights on it. So he has a couple lights lit. He's reading a book and he's watching, he liked I Love Raymond. So he's watching I Love Raymond and he's throwing down peanuts, right? And I go, what are you doing? He said, I'm reading. I said, no, what are you doing? I go, those are salty. And he lifts up the jar. It says, low salt. He's a retired physician. And he bought that label that said low salt. So then I looked to his left, and he's got hard pretzels that you can see the salt on them, right? So I told him, I said, you want to save some money? You want to save your heart? Stop that, and I'll bet we get you off of 2-year medicines. And we did, because we don't pay attention, and we don't read the label. Please pay attention and read the label. It's important. All right, now, the sugar part, this is bad and big. Sugar-free is a true term. That means that table sugar that we know from sugar cane is not in that product. But what is synthetic. Okay, remember I showed the carbon, oxygen, nitrogen, hydrogen. Those are organic chemicals or processes, chemistry that works in our body, no problems at all. But when you make a sugar that is something that's sweet tasting, in order to hit our taste buds to satisfy us with that product, you still have to get rid of it. And that's the problem, that these are hard for the body to get rid of. And how do they get out? Mostly kidney. What happens? Water takes them out. Okay, so if you're watching everything here, you should be in good shape, but still the point is, if you're taking something that is not natural sugar, but says sugar-free, whatever that product is, water's taking it out of your system. So that's drying you out. What is dehydration set up? Inflammation. Please pay attention to that, guys. It's so important. We have to get rid of the inflammation in the body. And it can't be done by reading the labels and watching the products, because and again, it's reversible. That's the other part of this. If you stop it, all this stuff reverses. Hard to stop though. We're all creatures of habit. And so if you get used to certain products, even though they may have the fructose corn syrup in it, and you have to taste it with and without. I had my children, Coca-Cola. They had 4 bottles of Coca-Cola and 4 cans of Coke. And these had regular sugar, and this had fructose corn syrup. You cannot believe the difference in taste. It's unbelievable. Unbelievable. But there's been fructose corn syrup since 1983. So most of the younger people don't know the difference. But if you try that, and where did they say you find it? It's the name of a popular Sheetz. Sheetz stores have regular, they say it comes out of Mexico. So if you ever want to see the difference between regular sugar and fructose corn syrup, go get a regular can of Coke and the one that comes from anywhere in Latin America, because it has real sugar. It's incredible. All right, guys, now the last one I want to talk about is genetically modified food, okay? And I'm putting that on the top of this list. Has anybody had the old watermelon that's long, it's not a tiger one, but it's kind of light green, and it has black seeds, and when you open it up, you see the sugar spray in the air? They still have those down at the strip. Those are the old watermelons by the old farmers that still have the same seeds from 100 years ago, 50 years ago. The newer ones, that some of them are even yellow, I don't know if you've seen those, but they have these white seeds scattered all through them. And as I'm watching my children eat it, like they're eating it and swallowing the seeds. And 2 of them are dogs. And I'm going, you're gonna have diverticular disease when you hit my age. And as they're munching on this watermelon, like, what are you talking about? I said, you're not supposed to swallow seeds. And they're like, well, what about cucumbers? I said, yeah, if you eat too many of those, you're gonna have diverticular disease too. But it's like they get into a pattern, and then once they get into this habit of eating it, they don't even pay attention to what's going on. Any Seed manipulation is genetic modification. And there's been changes in wheat, there's been changes in corn, there's been changes in a lot of the fruits that we eat. If you've seen some of the sizes of some of these, have you guys seen one of those huge cabbages yet? I mean, the thing was huge, looked like a basketball. And so I bought one just because I thought, well, I'll taste it, see what it's like. Doesn't have the same taste. It's genetically modified. It's kind of like steroids. What happened back in the day with the steroids in baseball? Those guys got bigger muscles, they could hit the ball further. Well, then they finally banned it because unless you're taking those steroids, you can't hit that many home runs in a season. It's the same concept with the genetically modified fruits that we eat. Biggest ones to pay attention to: wheat, corn, berries. Believe it or not, they said avocados. I can't spell it on the script. Avocados, the green things, they taste pretty good. And then the last one that they talk about, and I thought was amazing, sunflower seeds. I'm scribbling again. Apparently they're very common. I mean, I have a buddy in California, and he's the guy that tells me all this stuff. But when they say genetically modified, they mess with the seeds. And when I say mess with the seeds, it can be done now in labs. They call it splicing. So if you like a trait of a certain, say an apple, if you like the trait of a red apple, but you also like the delicious apples because of the flavor, like you can splice those genes and you can develop the one you want. And from my end of it, when I first heard about it, I remember when we took genetics in class, and you talked about like peas back in those days, and how we learned about genetics. It was all from each and every time that they did whatever change, you saw whatever the dominant gene was, took on the characteristics of whatever it happened to be with the pea. So I thought it was all normal when I first read it, but now what we're seeing is the effects it's having because of the culture and how it's grown. And they talk about a lot of these corns especially don't have the nitrogen in the soil. So again, I'm just bringing it up to everybody. That's why I kept it on the first page, guys, that the genetically modified foods, as well as the fructose corn syrup and stuff we already talked about, I'm not going to bring that back. This is the one I'm leaving you with. The uniqueness of the body. My daughter's due she's having my third granddaughter, when she due, the 3rd of September. And I was talking to my 2 sons that are docs. And one did surgery, so he did a little bit of OBGYN, and the other one did medicine, he did a lot. I worked at the Baltimore Street Clinic in 1980, and we delivered 250 babies in the 3 months that I was there. And to me, that's the miracle of life that they talk about is just phenomenal to me, that the baby can come through the birth canal without taking a breath, living off the umbilical cord. And then as it hits the air of the world, everything changes. And it's fascinating and miraculous to me. And so when I looked at, when I thought about the liver, the things it can do is remarkable. It protects us all. It's the first detector of infection, and it secretes chemicals that help your body do the things it needs to do to maintain, normal metabolic function. And what is metabolism? Everything we're doing while we're all sitting there, whatever you're thinking, multitasking. You could be thinking of what you're going to have for dinner tonight, what you're going to do tomorrow morning, who you have to call this afternoon. All those things you could be thinking and still listening to. That's the brilliance of the body and the mind, but the liver controls everything. And right now, we have a substance that has been legal in America at 100% since 1983 that has changed the outlook or the outcome for children that are eating the foods that have all the fructose corn syrup in it, all the salt in it, and all the sugars in it. and their generation doesn't listen. You know, I don't know if they're the Gen Zs, I can't keep up with all that stuff. But the way everything happens with them is it's such a fast pace, it's incredible. And the things they do at one time, like they're on Facebook with somebody, they're watching television with somebody, they're on the phone with somebody, and they have a book open that they say they're reading. Like that's the mindset today. And what I want to make sure of is that what we pay attention to within the liver is protected. One of the things that helps I'll say to my patients, you know the best thing you could do? What's that? Eat liver. And they go, oh, I can't stand that. No, it stinks, it's terrible. I have not one patient, not one, that'll eat liver to help them. Zero. And see, I was raised where the thalassemia was in the family, and so my grandmother used to always put liver in the meatballs. But she made the meatballs so good, it tasted like meatball to me. So we all ate liver when we were young, and we didn't even know about it. But the reason I put that up there is that's very, very good nutrition-wise. The thing you want to avoid is the meat, fats, and the portion, we'll say wallet. That's better than wallet size instead of the palm of the hand. You have to get the water in. Please get the water in. That's so vitally important. And then please read labels. You have to read the labels. And I would suggest that if you haven't had, we call it a complete blood test, because that shows us how your kidneys are, your electrolytes are, how your calcium and phosphorus are, shows where your protein is, and then it also shows bilirubin and liver function. And that's something that generally, you know, I mean, if you're super, super healthy, you don't need to get one more than every couple of years. But if you're taking medications, you want to make sure that you get that done at least once a year to get it checked. And then ultimately, remember what we talked about, inside the liver, these sinusoids, they make a triad. I'm not sure, there you go, there's a triad. And the hepatocyte's in the middle. And what occurs is everything flows to the hepatocyte, and the hepatocyte does all those different things. Detoxifies, adds something to it for it to move in a certain place, because everything that's bound gets bound in the liver. And so the liver is remarkable in all the things that it does. And the whole process that we run into is the liver function test. Elevation is abnormal. Remember, drugs, alcohol, infection, inflammation, congestive heart failure, all those things can contribute, but the one thing that we're looking for is fatty liver. All of those things that I listed, alcohol and fat, are the ones that are going to cause the fibrosis and cirrhosis that leads to death. Okay, let me just explain that one time real quick so everybody understands, and then I'll let you guys get out of here. And for the record, I was close on time today. I was only 3 minutes off. All right. Esophagus comes down to the stomach. Don't forget the pancreas is back here. Small intestine, liver, spleen's over here too. And then the large intestine making its way out. Everything from the small intestine goes to the liver. What happens when the fat increases? Inflammation that leads to fibrosis. What does fibrosis mean? Remember we drew that hepatocyte triad. This is the cell. The liver distends and contracts based upon the flow of blood. And so what occurs is, if there's fibrosis, that's a scar. And the scarring doesn't move. So now instead of it moving, it gets hard. And what occurs? fibrosis is less hepatocytes. So the liver now does not function normally, so what happens? The enzymes go up. So the enzymes you do have that aren't fibrotic go up. What's the thing that causes trouble? When this all backs up in pressure, the blood vessel, which is the superior intestinal artery, backs up. And so the blood vessels around the esophagus dilate. And that's when you can have what's called hematemesis. And that's when you cough up blood. And why does that occur? Because the liver doesn't distend because it's now fibrotic. So all the blood backs up to the esophagus, and they're called varices. And when you cough or sneeze or have increased pressure in the abdomen, it can cause bleeding. When you get to that point, you need a liver transplant. You know, it's the only way we're going to get things fixed. You know, and again, guys, it's so amazing to me as I was going through the reading that we're not talking about this. You know, because it's so important to recognize from 1992 till today, we went from 2.5% of children, it's now up to 85% of them have liver fat around their, it's just, that's not right. You know, and no one's saying anything. That's the part that frustrates me. And as I tell you, I talk to my children and they act like, you know, hey, you guys had, what did we have? No dose or something. Like that's what they claim, that they take all these energy drinks just to study for tests, which is BS. But, you know, I at least listen to them tell me. All right, does everybody understand the concept? Because the biggest thing I wanted to make sure everybody understood was salt is in everything to keep on the shelves. The fructose corn syrup is on everything to keep on the shelves. The genetically modified, the reason they modify it, by the way, is so that they don't die off in the field so they can produce more. And that genetically modified stuff causes us troubles as well. And sugar, guys, pay attention. Even regular sugar you should cut back on. But what's beating us up is the fructose corn syrup. Okay, that's what's causing the trouble that we're ending up with the fat around the liver. Good. Any questions, guys? Yes?
Why would a doctor put someone on who is not obese on Ozempic because they said he has been dying with fatty liver because they want him skinny?
Well, I think that's a good question. The question was, why would somebody that's not obese be put on Ozempic? Okay? And what happens is, if there's fat around the liver, doesn't mean you're gonna be obese. That's one of the risk factors for it. If you consume a lot of the salt, the genetically modified foods that you take in, the fructose corn syrup, you can still get fat around the liver. So I'm assuming that the doctor is prescribing the GLP, they call it, because that blocks the body from absorbing the sugar. So the sugar stays in the system and makes its way out. So that's why I would think, I don't know for sure, but that would be why I would allow somebody to take it if we've identified fat around the liver. And even though their BMI, which is the indication of obesity, if they're normal BMI, but we identify fat around the liver, then I could put them on a GLP. I would prefer a more natural way to get rid of the fat, like I told you, the exercise, watching what you're eating and stopping the ones that would cause the problem. But yes, I haven't, but I've seen people be put on GLPs that have normal body habitus, they're not obese, but they have fat around the liver and they're trying to get rid of the fat. Other questions, guys? Good, thanks for having me. And on the record, I was 2 minutes late, not 10 minutes late. Thanks, guys.